Hey guys, Bianca here with a video on core stability. Obviously a fundamental piece of our programming here at NACOA because it really is the missing link between performance and injury prevention, and really understanding how to use it and engage it is such a nuanced feeling that a lot of people aren't familiar with. So we're really going to break down some cues and tools to understanding it so that you can better strengthen it and activate it in your daily life. So, just a couple things before we get into our biofeedback tool. One is just a simple cue on breathing. A lot of us have a tendency to breathe just really shallow, just through our chest breathing. So all I want you guys to do is place your hands. I'm just gonna pull this up here so you can see my rib cage. You're just gonna place your hands on your rib cage, and I want you to think about breathing into your hands so that they expand laterally. So that's really what you want to be doing when you're breathing, is filling your rib cage and expanding laterally. So you can see when I take a breath, my hands move apart, and as I exhale, they come back together. So again, inhale, expand into the rib cage. Exhale, and then move back together. So you can just go ahead and try that on your own and just notice when you are breathing really shallow versus when you are filling your whole rib cage. So the second thing that we're going to talk about is pelvic floor, which is something that not a lot of people are familiar with, or maybe more in the female world because after pregnancy, kind of in touch with that, but a lot of guys aren't familiar, and a lot of people in general aren't. So it's really the muscles at the bottom of your pelvis, and they can contract and move up and down. So just to think about that, when you engage your pelvic floor, that's sort of the start for engaging that transverse abdominis muscle that wraps all the way around. So those muscles work in conjunction together to really create that spinal stability that we're looking for. So that's your deep inner core unit that we're talking about when we actually talk about core stability. So if you sit on any sort of level seat and really just sort of sit upright. And what I want you to be aware of is that as you're gonna be inhaling, I don't want any movement front or back. So you're gonna stay with this just slight lordotic curve. And then again, as you inhale, I want you to think right now about your pelvic, or your sit bones that are pushing into the chair. And then think about the space in between your sit bones. So then from there, you're gonna inhale and just try to draw that space in between your sit bones up. You'll notice that as you do that, right, I'm gonna relax again. You'll notice that if you draw that place in between your sit bones up, your belly button is going to naturally pull in, because there's no way you can think about drawing up from that place and push out your stomach. So that motion, that movement is the engagement of your pelvic floor and your TVA together. So that's what I want you to think about as we go through our exercises with the biofeedback tool. All right, so for this second piece, this is just a standard blood pressure cuff. They have biofeedback pads, but they do the same thing. And this is really just what we like to use to help give you that visual feedback on if what you're doing is really engaging what we want you to engage. So you're gonna place that right under the small of your back, right where that little arch is. And then from there, you wanna go ahead and pump it so that your initial pressure is at 40. And then from there, the first step is just practicing engaging. And as you breathe, you might see a little bit of movement up and down, and that's totally fine. So the goal is when we engage our inner core unit, which is like we practiced that when we were sitting, that pulling from the pelvic floor all the way in and up the belly button, you should see that needle rise. So that's increasing pressure around our spine. The goal is to get it from 40 to 70. So the line in between that 60 and 80 right there. And so our first test is gonna be to just get it up there and hold it. So I'm gonna inhale, draw up from my pelvic floor, and so that's our level 1. Our next test is gonna be to inhale and hold it there, and to be able to take little sips of breath, so we can do it not just when we're holding our breath. So we're gonna count out loud to 5. So again, I'm gonna inhale, pull up, and count 1, 2, 3, 4, 5. Again, it's important to remember that when we're doing that, we're not having any change in our hips, right? This is all from engagement of that inner core and not from pushing down on the pad. So now I'm gonna run through the other tests. So our next test from there is gonna be to move into heel marches. So I'm gonna inhale, engage. You can adjust your feet, and all you're gonna do is lift one foot off the ground, slowly drop it, and then alternate to the other side. Try to start with 3 or 5 on each side. And you want to make sure that you're holding it right at that 70 and not letting it drop down. Now, if you are dropping it down, that's totally fine. You're just knowing that the goal is to be able to hold a steady 70 pressure or greater without any drop for as many as you can do, but start with 3 on each side. So our next from there is gonna be, again, engage. And then you're gonna bring your feet up to tabletop. You're gonna watch that your knees aren't in front of your hips, because you can feel as soon as you do that, just can disengage your core. So you wanna bring it right here. The other thing that can happen as it gets more challenging is you start to kind of cone up. I don't know if you can see this, but you can feel the difference. You've basically released that deep inner core unit, and what's actually holding you in place is just your rectus abdominis. So you can see that kind of cone up, and you can feel the difference, because when you engage that back down, you can see how I almost start to shake. That feels immensely different than that, even though my hips didn't really move. So focus as it gets more challenging on really still pulling that belly button down and pulling up from that pelvic floor. So again, this is challenging. So I'm gonna engage. I'm gonna bring up, and then from this level, the next step is gonna be tapping the heel down. And then again, tap the heel on the other side. And again, 3 to 5 on each side. Totally no problem. I'll just do 20. Oh,
Keep going.
so hard. Okay, and then the third and final step, super challenging, but what you want to progress to, that we see people do all the time, and we program these dead bugs, but to do it with the blood pressure cuff is really, really hard. So you're just going to progress to straight legs going down. So inhale, tabletop, and then one leg is going to straighten, and then the other. So you're going to start with just straightening the leg. Then if you can maintain with that, you can straighten and lower and bring it back. Again, not letting the knees pass the hips. Thinking the whole time about pulling your belly button down without actually moving your pelvis at all. Okay, that's super hard. So practice that. Immediate difference in what you feel in the support in your spine. So that's the beginning to just get the feeling. Now we're going to apply it in a little practical set, a little mini core finisher, but you're trying to think of that same engagement that you had the whole time in these next series of exercises. All right, for our core finisher, you have 3 exercises. The first is going to be a kneeling bird dog. So that is just going to be right here. You can have a pad for your knees. This is really good for feedback. And then we're going to start with just a hold, and then we're going to do taps on each side, and then we'll switch sides. Then our next exercise is going to be a pull through. So you're going to lift the knees and then controlled pulling it through without letting the hips move. And then the last is going to be a box bear crawl. So you're going to be in that hovering position, and we're going to move around, in a box shape around the mat. Again, trying to keep our hips totally level and that inner core unit engaged, just like we practiced. And we're gonna do that all one direction and then reverse it all the other direction. We're gonna do it 2 times. Wish me luck. Okay. So we're gonna start out with 10 seconds on the hold. And as you're holding here, think about driving your knee down into the mat and your opposing hand down into the ground. You don't have to lift. Good, and tap down, that's 10 seconds. You don't have to lift your hands and legs super far because then you're gonna get yourself in this arch position. Just a little. 4, 5, 8, 2 more, 9, 10. Other side. So again, lift, drive down into the ground with your opposing. You can flex that foot and really push the heel out. That's gonna help engage the glute. Drawing that pelvic floor and belly button in and tapping it down. 1 for 10. Next exercise, we're going to just float those knees up and slide the kettlebell all the way through. The trick to this is thinking about really bracing before you pull so that you don't get your whole body twisting. On 5, we're going to do 10. 6, 7, 8, 9, 10. And we're going to go right into our bear crawl. Forward. You actually move opposing arms and legs. And laterally, you're going to move your hands together while your feet are apart. So it's opposite. Good. So that's round 1. We're going to do that essentially 3 more times. Going into the other direction. Okay, starting again with our hold. Taps. Other side. 10-second hold. This is your chance to really activate as much as you can. Create that tension and awareness. 10 taps. Good. Into our pull throughs, float the knees. Right into our bear crawl. I can't talk.
I'm getting battered.
I am getting battered.
Yeah, in the bear crawl.
Yep. Then go in the opposite direction. They're always like easier in my mind when I write them. Totally easier on paper. All right, you should be feeling some sort of activation shit in there. You gonna do it again? One more time, each direction. So, starting out, I would say switch sides. I can't remember what side I started on. So we're gonna start out with any side.
That looks good.
That looks good. 10 taps. Other side. Hold. Taps. Remember, the goal is to have as little movement around your hips and low back as possible. Good. Next, pull throughs, engage and then float. Pull through.
Und
10. And just moving around my mat. Keeping the hips still. The key is small steps. If you start to get really wide, your feet start to get out. So, just like that, I'm like, where? So just small steps, especially forward and backwards. All right, last round. Here we go. Up and hold. Driving the knee and hand down. Pull that belly button in. And tap it down. Switch. Up and hold.
nice.
Tap it down. All right. Second to last. Pull throughs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. Paddle crawls. Last time around. And that's it. And there you have it. 7-minute abs with Brittany. Just kidding, 8-minute abs with Bianca for your inner core. I hope that really helped. Practice, and we'll see you in the gym.
Start talking whatever you want to say.
Okay. Today we're just gonna talk a little bit about, no, how's my hands? All right, so for our little core finisher, you got 3 exercises. I was like making sure it's 3.